Hi, it's Christina with the Sisyphean Journal. Today is April 5th. I already covered our anniversary below. It was a suicide after an abortion performed by Dr. Leroy Carhart, who was a great hero of the abortion rights movement because of his willingness to do abortions on pretty much any pretext as late in the pregnancy as the woman requested it. Um, the young woman whose anniversary today, her aunt wrote a memoir about her and called her Haley Mason, and I haven't tried to identify her real name, but the link below to Haley's story. But as a companion piece, let's look at a more recent case with Leroy Carhart. Now, he has since gone to meet his maker, and if you're on Rumble, you can follow a link to um, this article, but I also have a video about Carhart's death. He was not exemplary. You know, the fact that he was willing to do third trimester abortions made him an unquestionable hero for some reason. His supporters are willing to overlook the death of Kristen Gilbert, an intellectually disabled teenager who she lost consciousness, she stopped breathing, went to cardiorespiratory arrest, and when the medics came, Carhart was doing CPR so ineptly they thought he was a bystander and they had trouble chasing him away from his patient. And then there was Jennifer McKenna Morbelli, who was aborting a loved and wanted baby because of an undisclosed prenatal diagnosis. When she was suffering from alarming complications, she called the emergency number Carhart gave, and it was the answering machine to his wife's equestrian supply business. Personally, I think these are inexcusable, but because he was willing to do abortions that late in the pregnancy, the abortion lobby is totally willing to overlook it. For them, Carhart is 100% a hero. So now we can look at, I'm going to have to fix a problem later. And this is an abortion that fortunately the woman escaped with her life, but her baby didn't, and it's rather a gruesome case. The woman's name was Hymenot, and she went to Carhart's facility in Bethesda, Maryland on May 20th of 2020, accompanied by her husband Abel. The couple had decided to abort their 23-week unborn baby because the child had been diagnosed with Down syndrome. Unfortunately, I don't know if they were given just gloom and doom prognostications and urged to abort, whether they just didn't understand that people with Down syndrome can have rich, full lives, but for whatever reason, that diagnosis made them decide that they were going to abort the baby. So on that day, staff performed an ultrasound and noticed that the placenta was in a posterior position. They gave Hymenot oral medication and inserted the little laminaria sticks to dilate her cervix. So she went to a nearby motel because, just like George Tiller, Leroy Carhart used local motels as kind of an annex to his medical practice. Supposedly these abortions are to address threats to the woman's life and health, but they somehow also don't need to be in a hospital. They can be in a motel room. Go figure. When Hymenot came in the next day, she reported that she was having pelvic pain and vaginal discharge, but she was told that was normal. Then Dr. Anchi Dango removed the laminaria, and Hymenot began to bleed very heavily. As Doe suctioned out amniotic fluid and began dismembering Hymenot's baby, she began to bleed profusely. And according to the lawsuit, she bled so profusely that both Dr. Doe and other staff were just splattered with blood. Carhart was called in to assist, and in spite of their efforts, they were unable to remove the entire fetus or to stop the blood loss. So they called Montgomery County Fire and Rescue to take Hymenot to Shady Grove Adventist Hospital. She was in critical condition, taken immediately to the operating room. Her cervix had been torn nearly off, only about a third of it still remaining connected. Her mangled unborn baby was in her abdominal cavity behind her uterus. The baby was missing its arms and most of its right leg, and its head was torn nearly off. Doe had also managed to damage Hymenot's appendix. The only way to get the bleeding under control was to remove the entire uterus. Hymenot and Abel sued the doctors and the facility, alleging not just injury but lack of informed consent. They asserted that had she known of the risk of damage to her uterus and appendix and the loss of her ability to ever have another child, Hymenot would not have consented to the abortion. Sadly, the lawsuit doesn't mention that she never would have consented to the abortion if she had known that her baby would be torn limb from limb. But doctors push for these. They, your baby's better off torn limb from limb than living with Down syndrome. I think that's very sad. But that's the way life is. People are willing to do this to babies just because they have a diagnosis that people are prejudiced against.